Hi, everyone. We will be getting started in a few minutes. You're in the right place. I know there was some confusion with some of the links, so we're just trying to sort all of that out. So we'll get started in just a few minutes. Just if you're in here right now, let me know that you can hear me. I just want to make sure my sound is good too. Okay, perfect. Thank you for letting me know. Oh, we'll just wait for a few more minutes and then we will go ahead and get started. All right, so we will go ahead and get started. Thank you for joining us today. Today we're talking about hair loss, and just a couple reminders. So if you are viewing from your phone, there's a little chat box. It will probably be underneath. And then if you're on your computer, it'll be on the right-hand side. And so please feel free to ask any questions at any time in that chat box, and we will do our best to get back to you. All right, so hair loss causes and what you can do. Let's go ahead and get started. So if you haven't met me before or haven't seen me around, my name is Dr. Berlin Wright. I'm a licensed naturopathic doctor in the state of Arizona. I went to Sonoran University of Health Sciences. They recently changed the name. It used to be SCNM. And I did a 2-year family practice residency after at the school as well. Currently, I focus on hormone imbalances, gut health, mental health, and autoimmune conditions, which hair loss ties into all of those. I really aim to address the root cause to really help the body heal itself and prevent disease, which is huge. And I love helping patients look and feel their best. All right, so what you will learn today, we'll talk a little bit about normal versus abnormal hair loss and what that looks like, the hair cycle, so how it actually grows and all of the phases, common types of hair loss and different causes that cause different types, labs to consider if you are experiencing hair loss, different treatment options, and really the naturopathic approach to hair loss, so how we go about treating it. And as always, a disclaimer, this is just for educational purposes. It's not medical advice. So if you're having any of these symptoms or experiencing hair loss, it's always best to check with your doctor before starting anything new. All right. So hair loss is so common. We hear it all the time. And it really can happen at any point in your life for a variety of different reasons. So how much hair loss is actually normal? Well, throughout the lifespan of someone, more than 80% of men and actually 50% of women by the age of 50 will experience some hair loss. And that could be, coming and going. It could be getting progressively worse. Typically, as we age, it does seem to be a little bit more prevalent. And we'll talk about some of the reasons why. It's normal to lose about 50 to 150 strands of hair per day. So this little picture on the right-hand side is showing about how much hair loss, how much it would look like. So the closer side on the left-hand side is going to be more of what we're looking at as normal, ranges from 10 hairs up to the bottom one is 200. So maybe a little less than that, but all of that could be considered pretty normal. The right-hand side, if it's looking more like that, that might be a little bit more abnormal or a little bit too much. And if you notice that you're significantly losing more hair, oftentimes for women, you'll notice it in the shower, if it's clogging the drain, something like that. If you see more on your pillowcase, or if you're pulling out like handfuls of hair, or every time you run your hand through your hair, like a big chunk comes out. Or of course, if you are noticing actual thinning on your scalp or any bald spots, you might have actual hair loss or excessive hair shedding. And just a fun fact, there's over 100,000 hair follicles on your scalp. All right, so the hair cycle, hair grows in 3 different phases. The first phase is the anagen phase. This is the active growth where your hair is continuing to grow. So if you didn't cut it this whole time, theoretically, it would continue to grow for that whole period. It can range anywhere from 2 to 6 years, sort of depending on what's going on in your life or different things. And this is where you're producing new cells. And as you can see in the picture, that shows you all of the parts of hair. So starting with the hair follicle, which is in the root, and then going all the way out. And the next phase is catagen. So usually that's only a couple weeks long. That's where the hair actually stops growing, and then it slowly starts to detach from the hair follicle at that bottom. And then the final phase is the telogen phase. This ranges from about 3 to 5 months, and they call this the resting phase. So this is where it's detached, and it's sort of just resting there until it's ready to fully fall out. And your body is preparing for the next anagen phase, so for it to start over. Most of your hair, so up to 90%, is in the anagen phase. Only about 1% is in that catagen phase, and then around 10% is usually in that telogen phase, which is where you're going to be losing. And that's why we usually say the hair growth cycle is about 3 months, because of that telogen phase being around 3-ish months long. All right, so hair shedding versus hair loss. So shedding is also called telogen effluvium, which is sort of a funny name, but mostly just occurs after a stress. So this can occur 2 to 3 months, generally after a big stressor of any kind. So things that could be stressful in life could be definitely like some type of emotional or trauma, some type of work stress or family life stress, excessive weight loss. Birth is a very stressful experience, even pregnancy and birth combined. Some type of like illness or infection, especially if you've had a fever. This has been, I think, more prevalent recently or in the past few years with the pandemic. Surgery as well can lead to it, and then stopping birth control pills or fluctuations in hormones. Usually this is temporary and the hair will grow back. What's happening is actually when you have a stressor of any kind, your hair is entering that telogen phase, so that third phase of like the resting, about to fall out phase, prematurely. And so then you have more in that phase than you normally would. And so it appears that you're having hair loss, but really it's just shedding so that the next cycle can sort of restart. Usually if you have this, it's hair thinning from all over, not just like a specific area. And it lasts generally about 6 to 9 months. If we can figure out what's going on and sort of treat it or stop it, it can be less. Or if this stressor continues, potentially it could be longer. And then hair loss. So hair loss is another form, I guess, and it's called alopecia in the medical world. It is oftentimes hereditary, and usually it's more in specific areas of the scalp. So it can be like in the hairline or maybe in the top of your head, and it can be permanent if it's not treated or addressed. All right. Just making sure we don't have any questions yet, so that looks good. Okay, so some common causes of hair loss. Hair loss is such a broad topic and so many things can contribute to it. But some of the big ones that we see, I've listed here. So genetics can play a role, absolutely. We talked about a couple of these a little bit. So infection, COVID, if you have had COVID at all, or even known someone, some people have experienced hair loss about 2 to 3 months after the infection. And that can be other infections as well. Nutrient deficiencies is a huge one. So, iron deficiency, anemia, or just having low iron, B vitamins, even some other vitamins and minerals like zinc and copper can affect it, vitamin D possibly, hormone imbalances. So definitely thyroid is a huge one that we want to look at for hair loss. And then low estrogen, progesterone. This commonly occurs in women when we're, trending more into the perimenopause, menopause age range, and we can see hair loss with that as well. And then during pregnancy, or even more so postpartum, is very common. There's also androgenic, which is usually a little bit more genetic, and this is also called male or female pattern baldness. Generally what's happening here is there are higher levels of DHT, or your body is more sensitive to that DHT. DHT is dihydrotestosterone, which is a form of testosterone, and generally has more of the, negative side effects of testosterone, but those can be, sometimes acne or hair growth, abnormal hair growth for women, or hair loss on your head also. Stress, like we talked about, of any form can absolutely lead to hair loss. Alopecia areata is an autoimmune condition that you will also see hair loss with. Certain medications might lead to it. Insulin resistance or blood sugar dysregulation can absolutely also have hair loss as a side effect. And then seborrheic dermatitis, which is more of like a rash or a condition of the scalp, sometimes caused from yeast or other things, and there have been shown to be more hair loss or much more hair loss with that condition. All right, so this is just a quick little slide showing different types of alopecia or hair loss and where they show up. So I'll just go through them quickly. So alopecia areata is that autoimmune condition. So as you can see, it looks more like little circular or oval spots that are in certain areas of the scalp. And so that's more specific to that type of hair loss. There are also a couple other ones, alopecia totalis, which is where you might lose all of your hair on your scalp. Alopecia universalis is where you might lose all of the hair on your body, so eyebrows, even from the rest of your body, arms, legs, stuff like that. Androgenic alopecia, so there's both male and female. Those are generally the similar or the same mechanism with that DHT that we talked about. But in males, usually it'll start to present as a receding hairline. That's usually the first sign, but also sometimes on more of the crown of the head. And then for women with that, usually it can be all over, but oftentimes it's in the part actually that you start to notice it the most, and then sometimes moves into the hairline and crown as well. Traction alopecia, this is actually more from like hair styling or products, that kind of thing. And it's if you repeatedly pull the hair from, ponytails or braids or maybe extensions or something like that. And that's what that one is. And then, diffuse hair loss, sort of a little bit of thinning all over. Also, we see oftentimes with hormones or nutrient deficiencies. So those are some of the common places that we'll see it from and why. Alrighty, so some labs to check if you are experiencing hair loss. I will say that, depending on the person and what's going on, we might do all of these or maybe some other ones. So it's very specific to you, but these are some common ones that we like to check if you do have hair loss. So there is some genetic testing that can be done. This is looking more so for different genes that might be related to hair loss or polymorphisms, which is like a genetic mutation that might be passed down. And there are a few specific ones that increase your risk of hair loss throughout your life. So this might be a good idea if, maybe your mom or dad's side of the family and all of them are seeming to have hair loss. It might be good just to get it checked out and see if there's anything that can be done to help prevent or slow it down. This is generally genetic testing can be done with like a mouth swab, a cheek swab, or there's a few different ways, but that's usually the one that I see for this specific type. Looking at more of a CBC CMP, this is just going to look at your basics to see if there's any infections going on, look at red blood cells to see if maybe iron could be an issue. And then a CMP might look at your blood sugar, your kidney function, your liver function, just get some basics. Micronutrient testing can be very valuable for this. So it'll look at all of your B vitamins, definitely vitamin D, and then also zinc, copper, some of the other ones. And this picture is just an example of a result of a micronutrient test. And this is usually specialty testing, but it's very comprehensive and can give us a great idea of what's happening in your body and where we need to support you specifically. Iron panel, absolutely, especially with menstruating women, other people too, but absolutely with menstruating women. And an iron panel is just going to really give us an indication if there might be iron deficiency anemia, and that might be contributing to your hair loss. thyroid hormone. So hypothyroidism or low thyroid function is commonly associated with hair loss and imbalances in general, but we want to make sure that we see if that's going on, if we need to optimize your thyroid or address any even autoimmune thyroid conditions that might be underlying. Other hormones, including your sex hormones, so this could be estrogen, testosterone, progesterone, DHEA, and then for hair loss, we usually do go ahead and check DHT, and again, that's dihydrotestosterone, which testosterone can convert to dihydrotestosterone, and in some people, it just happens more than others. That can be due to genetics or other factors, and so we can see if that level might be elevated in you. Cortisol is a great test to look at stress and see if there might be a lot of stress going on in your life. And then insulin and blood sugar, since that can also affect the hair growth. Alrighty. So we've had some hair loss. Now what? Some treatment options. So again, this is very broad. There's so many different options for treatment. And so I'll just highlight some of the main ones that we often recommend. And then, based on your specific situation, maybe labs, some of these might be more effective than others for you specifically. So one of the main underlying causes for a lot of the different causes of hair loss is actually poor blood circulation. So there's not enough blood flow to the scalp, which then makes it hard for your hair to grow. And so one of the main goals of many treatments is increasing blood circulation or blood flow to that area. So something that you can do that you might have seen is massage the scalp, actually. And there are different tools for it, or just using your fingers and just massaging the area. You can even use some essential oils. Rosemary is a really great one that helps to bring blood flow up to the skin. So that's an easy option that you can do. Also, correcting any nutritional deficiencies. So, if you have low iron or your zinc and copper aren't well balanced, or B vitamins, or maybe even vitamin D, making sure that those are on board and optimized. And then along with that, eating a healthy, well-balanced diet to make sure that you're getting all your nutrients and vitamins and everything that you need to support hair growth. Decreasing stress. So if stress is a big one in your life, which it oftentimes is for many of us, we want to work on different ways to decrease stress. So meditation can be great, breathing exercises, exercise in general, working out, which also will help with blood flow. So that's a double one there. And then sleep, making sure you're getting adequate sleep is very important. Nutraceuticals. So these could be different types of supplements. There are so many on the market for hair growth, and we're not tied to one specific one, although we do often use Nutrafol and have seen great results with it. They have a lot of great research as well. And Nutrafol, I have some here. So I don't know if you guys can see it, but that's what it looks like. There's also a picture on that slide. And this really gives you a comprehensive, like all of the vitamins and minerals that you might need for hair growth. And so it does have some of your basics, vitamin C, vitamin A, has some biotin in there, zinc, selenium, and then it has some collagen and some other herbs that are really great. So it's just a good comprehensive support. And then I mentioned saw palmetto on there, mostly because this is so common, and you might have heard of this in the hair loss world. And really what saw palmetto is doing, it's an herb that helps to block the conversion of testosterone to dihydrotestosterone. And so if you have more of that androgenic hair loss, more of the receding hairline, or top of your head type of stuff, this might be more helpful for that type. And I think we have a question. Let me see. That is a great question. So we have a question if you have had hair loss and maybe related to COVID. It started happening about a couple months ago, or about 2 months after COVID. So there's a lot of different things. So supporting the body with a lot of like nutrients and even the supplements can be helpful. But I think a lot of that is just knowing that it's likely temporary, that what happened is that hair, because of the stressor, went into that telogen, that third phase of hair growth, a little bit too soon. And so you're going to notice more hair shedding while the new hair is growing. And so knowing that it's temporary can be helpful, but a lot of the things we talk about can also be helpful for that type of hair loss. Nutrafol has been one that's, just giving you the basics so that your body can help to grow that. And then even some of the other stuff that we'll talk about in just a bit can also be helpful. You can also use topical treatments. So there's different serums that might be helpful. There are shampoos that are specific for it. There's actually a lot of research on ketoconazole, which is an antifungal or anti-yeast. And they do make this in a shampoo form. And it has pretty good results. And I don't know that I couldn't find the mechanism of why necessarily, but it may be because it's bringing blood flow to the area a little bit, or treating any underlying yeast infections that might be inhibiting the growth. But that was interesting. And then peptides have been huge with it also. So peptides are basically a protein that your body makes. It's the underlying amino acids that help to support in different areas. So there's one specifically, there are a few for hair growth, but this is probably the most common one that we've seen the most benefit from, and that is GHK-Cu. It encourages hair growth and increases blood circulation to the scalp again, and also helps to block DHT. So you're sort of getting a good comprehensive from each angle there with the hair, and so that can work really well as well. And then again, the hair growth cycle is about 3 months. So for a lot of treatments, you will have to stick with them for at least that long to see if you have results. So being patient with it, as much as you can. Okay, but what about biotin and collagen? These are probably ones that you've heard all the time for hair and promoted in, every supplement. So biotin is a B vitamin. It is B7. We actually do generally get enough biotin in our food. So in some of the major foods are eggs, meat, dairy, oats, spinach, but it's in a lot of different foods. And there's actually limited research demonstrating that it is effective for hair growth or hair loss, unless there's a known deficiency. And in that case, if there is a deficiency, like say you did a micronutrient test and it was low and you took biotin, it is very, very helpful for that. But just for the general person with hair loss, it may or may not be that helpful. And then collagen. So collagen, again, is giving us the building blocks needed for hair growth. And it can be helpful for skin, nails, other things throughout the body. But there's really mixed research on if it's helpful for hair growth, unless, again, there's a true deficiency. So, my take on this is biotin and collagen, I think, are still definitely a piece of the puzzle, but not the whole story. And taking them individually might not give you the results you're looking for unless you're truly deficient. So more of a comprehensive approach is probably going to be helpful. Okay, some other treatment options. So Rogaine, you might have heard of. It's also minoxidil. This is best for androgenic hair loss. Generally, this is applied topically, and it helps to extend the hair growth cycle and makes hair appear a little bit thicker. So the upside is it definitely, you can have great results with it. The downside of it is once you start using it, you sort of have to continue to use it to see the progress or keep the progress. So as soon as you stop, oftentimes any hair growth that you've seen will actually go away again. So it's more of a long-term treatment, unfortunately. Other medications, spironolactone is one that helps to block the androgen receptors, so can help a lot with acne, the facial hair growth in women, and hair loss, especially if it's more of that male-female pattern baldness, that type of hair loss. And then finasteride or dutasteride, finasteride is also known as Propecia, can help with that male pattern baldness. And it can work pretty well, but also can have some side effects. So you just want to, make sure you're doing everything you can to help support hair growth without too many side effects. Red light therapy cap is another option. So that's what this picture is on the top left. It's a low-level laser therapy. So this actually helps to encourage hair growth by increasing the blood flow, which we've talked about how that's a major cause of it. And it's very safe, tolerable, doesn't hurt, it's not invasive, and so it can be a really great option. You do have to be committed to it, right? So about 15 to 20 minute sessions, probably a few times per week for at least 3 to 4 months, but could be a great option. And then surgical hair transplant is another option. So this is done usually by a dermatologist or a plastic surgeon, and they actually take the terminal hairs, so in your scalp from an unaffected area, so where there's good hair growth, and they actually transplant it into the area where there might be hair loss. It can be a really good option and very effective, but it is invasive, can be more expensive, more risks to it as well. And then PRP hair restoration. So this is something that we can do here, and it can be very effective in treating many different types of hair loss, but also especially that male-female pattern baldness type. It helps to actually prevent hair loss and at the same time also promotes new hair growth, which is great. Another great option for this is actually if you are getting a hair transplant or thinking about that, this would be a great addition with that to maintain the hair and also make sure that it's healthy and supported. It works, one of the ways that it works is by improving follicle vascularization, which basically is just saying increasing blood flow and circulation to the scalp. And it also inhibits or stops apoptosis, which is death of those hair follicles or cells. So it basically allows you to stay in that first phase of hair growth, that anagen phase, a little bit longer. And so then your hair can keep growing for longer. And also that telogen phase, the last phase, it allows you to go from that phase back to the first phase a little bit more quicker. So the turnaround is more quick. Generally for PRP, we do recommend at least 3 sessions and about 6 weeks apart. And then this diagram is just sort of going through the process of it. So what you would do is come in, we would draw your blood, and then we spin it down, centrifuge it, and that the middle part is showing that at the bottom, basically the platelet poor plasma is at the top, the platelet rich is in the middle, which is what we want, and then the red blood cells are on that bottom. So what we would do is take out that middle part, that platelet-rich plasma, and we would actually inject it into the scalp to help bring those good cells into your scalp directly. And it's, maybe a little uncomfortable, but it's not super painful, which is great. And you're awake. It's not like, a surgical procedure. So can be a really great option. All right, and then the naturopathic approach to hair loss. So, identifying and treating the root cause of hair loss with exams or lab testing and giving the body what it needs. So, if you're low in iron, if you have low thyroid function, we want to make sure that we're providing those nutrients or hormones or whatever you might need to your body so that it can rebalance and work to grow more hair. Addressing diet and lifestyle. So if stress is a big thing, we want to work with stress management, making sure you're sleeping enough, diet is healthy, and then also addressing more of the, topical hair or styling type of things, so that you're using good quality hair products, not over styling or coloring your hair or using like too many things that would be rough and pulling out your hair, stuff like that. Speed up hair growth with, peptides or PRP injections, or both possibly. And then, the best outcomes are really if we address each one of these on an individual basis. So what you need and what is going on with your body, and then supporting the body in multiple different ways since, we are a full person. We're not just our scalp by itself. And so we want to make sure that you're getting everything that you need your body so that it can help heal ultimately. And I think that's about it. So we know hair loss is such a huge topic and so prevalent. And so we just wanted to give you guys a little bit more information and support and options because, hair is such a personal part of us and it can affect our confidence. It's part of our identity. It helps us express ourselves. And so yeah. Any questions that you guys might have? Feel free to type them in the chat and we will get back to you on those. I'll give you guys a couple minutes if you have any. We also, like I mentioned, we do offer PRP. We have some of the supplements here. So if you have any additional questions or specific things, you can always give us a call to either schedule a consult or talk with someone a little bit more about what would be good for you. But there's a ton of options, which is, always a good thing. Does wearing a ponytail every day cause hair loss? So this sort of depends on the person and how tight it is. So if it's a loose one, it's probably okay. If it's really tight, it might be causing a little bit of distress on the scalp and the hair follicles. And also it might depend, when you pull it out, is it yanking on your hair and pulling out a bunch of hairs with it? Or is it more gentle? So I don't think it's bad to wear a ponytail, but, making sure that it's not too tight or pulling all the hairs out with it. But good question. All right, any other questions? Let's see. Is burning scalp or itchiness common for some of these types of hair loss? So generally with an itchiness, there might be an underlying cause, of more like a scalp, I don't want to say infection, but a rash or something like that seborrheic dermatitis sometimes can cause itchiness. Burning scalp, probably depends person to person on what's going on or if you're using different products or different things like that. But the itchiness might be showing that there's an underlying thing that might be even contributing to the hair loss. So it might be good to look at that also. And one more question. How long to take supplements for? So it really depends on what supplements they are and what you're trying to address. And, for example, if you're stressed long-term, we want to make sure that you have stress support on board, whether it's lifestyle or supplements or other things. But for a good rule of thumb, I would say any supplements that you're going to try for hair loss, I would do for at least 3 months, just because that's how long the hair growth cycle is. So you won't really be able to tell if it is helpful or not if you don't give it that full 3 months. And then again, just depending person to person, what's going on in your life, you might want to continue a little bit longer. And yeah, so at least 3 months, I would say. Any other questions? Nothing else? Alrighty, well, thank you guys so much for joining. I hope this was informative and answered some of your questions. If you ever have more questions or concerns or anything, this is our information. We have our phone number listed, or you can always email us, info@desertwellnesscenter.com. And thank you guys for joining and have a great rest of your day.